Good afternoon and welcome to the City of Toronto COVID-19 media briefing for Wednesday, November the 4th. Joining us is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Go ahead, Mayor Tory.
Well, good afternoon. We remain 100% committed as a city to protecting the health of residents and saving lives in the face of an unprecedented threat. That has been the objective throughout this pandemic, and that is why I've listened to our public health experts throughout the pandemic. Yesterday, the province unveiled its COVID-19 response framework that gives us a path forward to make sure that in the City of Toronto we can open our doors safely. I have been clear throughout that I want restaurants and gyms and every other kind of business or any other place to open safely and to stay open safely, safely being key as it always has been throughout this entire ongoing discussion. We are doing everything we can to make that possible in the days ahead. I know the vast majority of people in the affected industries want to work with us to open safely and to stay open safely. I've heard from many of them, and I understand their frustration. I understand the immense difficulties, personal and business, that they've been experiencing in the last period of time. One source of that frustration concerns the uncertainty of opening and closing, and it is my clear intention, working with the province and with Toronto Public Health, to safely provide for greater certainty and stability going forward. You've heard me talk about this repeatedly for weeks. We need a way forward while making absolutely sure that we do not let up one bit on our efforts to beat the second wave and stop the spread of COVID-19. The virus itself can do way more harm than any proposed public health measure. The City will be working closely with Toronto Public Health to do everything we can to help open doors while keeping Torontonians, all Torontonians, safe and healthy. The new framework speaks to both of those priorities, as does the time Toronto will take to get this right. That speaks to both of those priorities. Dr. Davila today will speak about the work that Toronto Public Health is doing to prepare for November the 14th. We will be working quickly to communicate with restaurants and gyms, thousands of them, as we prepare for next week and make sure they have all the information they need to reopen safely and to follow the rules, as most have done very well throughout. I'm also continuing to fight for more support for the businesses impacted by the public health measures. I welcome the fact that legislation was introduced this week by Deputy Prime Minister and Finance Minister Chrystia Freeland to help small businesses, including restaurants, hard hit by the pandemic. I note some changes have been made to respond to concerns expressed to me by the industry, which I passed along to her directly. And I continue to urge all parties in the House of Commons to pass this legislation quickly so that much-needed relief can actually begin to flow. COVID-19 is going to be with us for some time to come, and we are trying hard to make our decisions accordingly. We are very mindful of short-term needs, but we must also take the long view when it comes to the overall well-being of the entire city and the health of all of its residents. That means continuing to follow public health advice while also working to make sure that as much of our city can be open safely as possible. We need to ensure that we can successfully manage the threat going forward into the winter. I know people are concerned about the rising case counts here and the increasing cases across Canada and indeed around the world. We advocated for action a month ago in the hopes that we could avoid these types of larger and longer and much more widespread lockdowns that we are seeing being imposed right now in other jurisdictions. We started to see our numbers plateau in recent days, and we don't want to go backwards. Despite the ongoing sacrifices of many, our public health dashboard, open for all to see on toronto.ca, remains at red. People are testing positive every day. People are going into hospital every day. And tragically, we continue to see some people pass away from this virus. That is why we continue to urge people to follow public health advice and to not let their guard down in their own daily lives. I know this is an incredibly tough time. We've been trying to live with COVID-19 and its dangers for almost 9 months now. I continue to be thankful and proud that the vast majority of Toronto residents continue to do the right thing and continue to take this virus seriously. We will get through this thanks to your determination and resolve. In my job, I continue to do the same thing. Take this deadly virus very seriously and make the best decisions I can based on the best expert advice I can get, with the health and well-being of all 3 million residents of the City of Toronto always front and center in my mind. This is not an easy thing to achieve, especially given all the unknowns concerning this virus. But we are doing our best, and I am confident we will get through this thanks to your patience and your commitment. I will now ask Dr. Davila to present her remarks for today.
Thank you, Mayor Tory, and good afternoon, everyone. Today, I'm reporting 338 COVID-19 cases. 159 people in Toronto are hospitalized as a result of COVID-19, and 36 people are in the ICU. Today, I want to talk to you about how Toronto Public Health is working to support the safest reopening possible for our city. Back in early October, we recommended targeted, temporary restrictions for the City of Toronto. And we did so because Toronto's rising case counts were trending in the wrong direction. It was clear that an intervention was needed to disrupt the very real risk that viral spread could run out of control. We have seen what this virus is capable of. We need only look to the United States or much of Europe to see what can happen when COVID gains the upper hand. Data from Toronto and around the world shows us that indoor settings where people come into close contact make it easier for the virus to spread. Bars and restaurants are closed spaces that create close contact between people, usually for extended periods of time. Additionally, at a bar or restaurant, mask wearing isn't practical most of the time. All this is true of gym settings as well, with the additional concern that gyms are places where people are physically active, and therefore heavy respiration is expected, further facilitating the potential for virus spread. But we also know that closing bars, restaurants, and gyms has a high cost for people's livelihoods, for our local economy, and for our mental and physical health. Going forward, our goal is to see the temporary restrictions lifted in the safest way possible, creating conditions that increase the likelihood that Toronto can remain that way. That's why we've asked the Ontario government for additional time to ensure that this can be done as safely as possible in our city, given our unique size and density, and the thousands and thousands of businesses that need clear information on how they can sustainably reopen. At present, our 7-day moving average of case counts continues to increase. We are starting to see more hospitalizations. Yesterday, we reported a record high in daily COVID-19 cases. The figure is concerning, but must be examined in the context of the case count figures for several days on either side of it. The need to monitor the data relating to virus spread was another reason for a later reopening date. To put it simply, our objective is to reopen in as safe a way as is possible and to create the conditions and public health infrastructure to support this. It's not about business or health. We can and must support both, and we must do everything we can to get this right. So, what are we doing to create the conditions for the safest reopening possible? Alongside our provincial partners, we're scaling up the necessary public health infrastructure to help keep cases low and prevent virus spread as much as possible. A safe reopening will rely on having a comprehensive testing approach and capacity. on rapid case identification and isolation, on timely contact identification and follow-up, on supports for vulnerable and marginalized populations, and protections for workers who are needed to keep the health system and the city up and running. Our team at Toronto Public Health is significantly scaling up our work and our approach in case management and in contact tracing. Toronto Public Health has never stopped case management and contact tracing in some key areas. We have always contacted every single person with a confirmed COVID-19 infection. That work never stopped. We have and we continue to conduct contact tracing work in high-risk settings like schools, daycares, long-term care homes, and healthcare settings. And we are working towards resuming full contact tracing in our city. Since the beginning of the pandemic, we have increased our case and contact team from 50 to roughly 700, the largest in the country. And we have 200 additional staff coming on board this month. We're in discussions with 3 Toronto hospitals, Sunnybrook, Michael Garron, and Humber River, to partner in arrangements to add even more capacity. We're making increased use of technological innovations, including text messaging tools, robocalls for low-risk contacts, and online surveys. In the coming days, I will be sharing details on these new enhancements. We're also looking to the best evidence and the experience of other jurisdictions around the world, and we are working on targeting contact tracing to identify superspreaders with a proactive focus on finding events that cause a big number of infections and the people who are superspreaders. Contact tracing is a key part of our response. At Toronto Public Health, our objective is not simply to do it well, but to be amongst the best in the world. But we can't do all this safer reopening work on our own. Managing COVID-19 requires efforts by all levels of government. I understand that the Provincial Minister of Health has made clear her willingness to help. And there are a number of important steps that should still be taken. Alongside case management and contact tracing, accessible and available testing needs to be scaled up. Sick day provisions should be enacted by the province so that people don't have to choose between staying home or going to work when they're sick. We also believe that governments must continue to support employees and businesses to financially sustain and protect them through the pandemic. There must be workplace supports and protections for the people whose occupation is an essential service that we all rely on, and work that has to be done in person and on the job in places like hospitals, grocery stores, pharmacies, long-term care homes, and food production and distribution facilities. We all have one shared fear: that COVID-19 will do its worst to us or to someone we love. As Medical Officer of Health, in pandemic conditions, my primary concern is for the people of Toronto. While the health of the public is not only measured by virus spread is the biggest risk to public health at this time. The lifting of any restrictions should be expected to result in an increase of virus spread. This has happened everywhere. Now that we have a formal provincial framework with measures that will guide the decision-making process at the policy level, at Toronto Public Health, we will do absolutely everything in our power to facilitate the safest reopening possible. And, as I've done throughout this pandemic, if I feel that additional measures or interventions are required, or that more time is required, I will tell you. Finally, I want to speak directly to you, the people of Toronto. Whatever happens, wherever you may or may not go, no matter how long the pandemic lasts, the single biggest mistake you can make is letting your guard down in terms of protecting yourself from COVID-19. So please, don't let your guard down around your coworkers. Don't let your guard down around your extended family or your friends. Don't let your guard down when you notice you're experiencing symptoms of COVID-19. Get tested. At Toronto Public Health, we will not let our guard down, and we encourage every Torontonian to remain vigilant as well. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. As you know, from the outset of COVID-19 in Toronto, our teams have been responding to complaints that arise as a result of the various provisions of the Reopening Ontario Act. The framework that was announced yesterday afternoon by the Province of Ontario includes a number of significant regulatory amendments. It also introduces a number of new restrictions and conditions that we will need to deal with on an ongoing basis. As soon as we receive the final regulations from the Province of Ontario, we will develop comprehensive plans for the implementation and enforcement of the specific restrictions, provisions, and conditions contained within the new framework. We are already convening our enforcement, legal, and communications teams in order to begin to develop our amended response and enforcement strategy in advance of receiving the revised regulations. As always, we remain directly connected with each of the city's divisions, agencies, and corporations on a daily basis, and remain committed to ensuring that city services continue to be provided in a safe and effective manner that meet the needs of our residents. Toronto is home to roughly 7,500 restaurants, bars, and nightclubs, in addition to many gyms and other facilities where people gather. While responding to the revised restrictions and provisions contained within the provincial framework will be a challenge, I'm confident that our team will continue to respond quickly to these changes. Our operational and enforcement plans will continue to prioritize public health and safety for all Torontonians. We will provide additional updates and specifics in the coming days as we develop and finalize our revised plans. Thank you.
Thank you, Mayor Tory, Dr. Davila, and Chief Pegg. We will now open the floor to questions. As a reminder, it's one question, one follow-up. Media will need to unmute and mute when you are up. We also have staff on the line who can answer your questions if you need further details. First up, we have Lucas Meyer from News Talk 1010. Go ahead, Lucas.
Thank you. Mayor Tory, is there still some uncertainty that bars and restaurants can actually implement indoor dining?
Well, to the extent there is any uncertainty, it's going to be resolved by way of written advice that is going to be given, because we have been, in light of the changes in the rules proposed to take effect on November 14th, which open up indoor dining, as it were, we realize that raises some questions about some of the other arrangements people had made, and we will be supplying written advice in advance of November the 14th to all restaurants so they will know exactly what the rules are, and I would refer them as well to the wording of the provincial regulations.
And Dr. Davila, I know you touched on this in the opening, but can you elaborate a little bit on, and if there is sector-specific data as well, if there is more of that, what is it in Toronto that caused you to recommend that more time?
So I think the situation here, and you've heard us all talk about this, this is a goal towards reopening as safely as possible. right? Trying to strike the best balance in our given situation and recognizing our unique circumstances here in Toronto. This is a challenging virus, and it is important that we take the time to reopen as safely as possible. That's really the rationale behind the timeline, to understand and make sure that we understand our current situation, monitor data, and also the ability for us to really work with the many businesses and partners that we have in the city to make sure that we're doing this right.
Thank you, Lucas. Next up, we have Mark McAllister from City News. Go ahead, Mark.
Thank you. Given all the reasons you had for waiting another week, I guess the natural question is a week going to be enough? Would you wish to have more at this point?
Well, you know, I think it's always difficult to speculate, you know, on time and what might happen in the future. But I think that what you've heard all of us here say is that we are really committed to making sure that we're able to do our part here at the city to make sure that we're doing everything we can to support as safe a reopening as possible. From a public health perspective, we need to continue to scale up all the work that we're doing in the response, including that which focuses on case and contact management, and we're asking our provincial counterparts to scale up their aspects of the response, not the least of which is testing. And then finally, we've got many, many businesses to communicate with. We know that there are lots of questions out there, so we look forward to getting some written advice from the province to understand what the new guidelines are governing as safe and reopening as is possible. And we're going to communicate with all the business partners as best we can so that it's clear what's required and what people need to do throughout the city, whether as employees or as business owners or as residents, to support as safe a reopening as is possible.
And Dr. Davila, do you agree with the response framework and how it's been laid out and what is required for each of the different levels? Have you been part of that conversation?
You know, the response framework is indeed that of the provinces. That's their own framework, and I think it's actually really good to have a response framework that clearly articulates what are the thresholds and what are the requirements that they're looking at in order to support as safe a reopening as is possible throughout the province. I think it's also really important that they communicated it publicly. I think that's necessary, and I think it's helpful so that people throughout the province of Ontario understand what it is that our provincial counterparts are looking at as they seek to make the best decisions on behalf of the province.
Thank you, Mark. Next up, we have Matt Bingley from Global. Go ahead, Matt.
Hi, Dr. Davila. Is it fair to say that contact tracing will be the backbone of the city doing this safely?
So, Matt, I think that's an important component of it, but it's certainly not the only one. We know that case and contact tracing has been a key component to that which local public health can do in response to a pandemic like the one that we're experiencing. But certainly providing advice to our city partners, providing advice to decision makers here at the city and at the provincial levels of government, ensuring that data are available and communicated to all parties involved and to the public in particular, I think are also part and parcel of the role that we play in supporting the response. And obviously, as we move forward and as we look forward to the availability of COVID-19 vaccine, that will also be another key component and another role for us to play in public health as part of the response.
Okay, and just for my follow-up, and I'll preface it by saying that I already know that testing is under the purview of the province, but when you talk about them scaling up certain things, when we see testing persistently below 30,000 per day, and you are saying that we need to see strong testing, are the current levels of testing the province is administering good enough for the city to open safely?
So, I think when we look at testing levels or numbers are one dimension, right? But they are only one dimension. I think the most important part when we talk about testing is testing available and accessible to those who warrant and need that testing? Because fundamentally, the role of testing is to actually help us as quickly as possible identify infections so that we, within the context of local public health, can actually follow up on those cases, ensure that they're isolated, and understand where they where they might have acquired the disease from, and to whom they might have spread that disease in their period of communicability. So I think testing is part and parcel of the sum total of the response, but I would never over-focus on one particular dimension. The idea is, are we deploying testing in the best fashion to help us with the response, to identify those cases, and to follow up so that we can control the spread of disease as efficiently and as effectively as possible?
And could I just add a word to that, not being an expert at all, and don't pretend to be with respect to testing. You've heard from one of our experts. But we have, I think, shown ourselves to be good partners as a city, together with Toronto Public Health, together with the province, and these wonderful community health organizations in establishing now dozens of new testing that try to address exactly what Dr. Davila talked about, which is making testing more accessible to people. And I visited with the Premier, one of them, this past Sunday, and I think part of the reason for our visiting was to see exactly what went on so that we would know how we could try to replicate that model with the help of these community health organizations who know the people and the people know them in areas where we need to get our testing levels up.
Thanks, Matt. Next up, we have Francine Copin from the Toronto Star. Go ahead, Francine. We'll just need you to unmute yourself, please. Francine? Oh, there you go. Go ahead.
Hi. Good afternoon. My question is for Dr. Davila. Looking at the new guidelines that were issued yesterday by the province, the data for moving into control or lockdown seems to be much higher than what we've been relying on in the past. So, for example, if you look at control, which is essentially modified stage 2, which is, control, which is, I think, what Toronto is in now, the levels need to be much higher before that's invoked. So you need a reproductive rate of 1.2, you need a percentage positivity of 10%, you need a weekly incident rate of 100 per 100,000. And I'm wondering, have they set the bar too high, or do you have concerns about that?
When it comes to the thresholds, Francine, I think it's best to direct those questions to my provincial counterparts. But I do think that it is really important to note, and I think it's necessary and helpful to actually have a framework that articulates, what the standards are, what the different levels are, and so that we're all able across the province to understand what is guiding the interventions and actions on the part of the provincial government as they seek to provide, as safe an environment as is possible throughout the entire province. I think that, as you've heard us say many, many times here today, that, my focus certainly is on trying to ensure that we're creating the best conditions possible for optimal public health. And we recognize that health is this sum total of, yes, virus control, but also managing and making sure that we have the conditions to support livelihoods and businesses and mental and social health throughout our entire city. So I think that when we look at having this framework, it does allow for some flexibility, it allows for latitude, and certainly in our case, we are being afforded that opportunity to be more flexible, to take into consideration our unique circumstances here in Toronto, and to ensure that we're doing the best we can to support as safe a reopening as is possible.
Okay, so I have a follow-up question. I understand that these are thresholds that are set by the province, and I have sent questions to the province about them. However, you are working within these thresholds, and I guess my question to you is, they seem higher than what we've been working with. Would you agree?
Well, I think that within this context, my job is to make sure that I'm providing the best advice and helping the people of Toronto navigate as best as possible, whatever the circumstances are. So regardless of what virus spread looks like, regardless of what the thresholds are or what the guidance is and what the policy decisions are, my job is to make sure that we do the best we can here at Toronto Public Health to support the health of the population of the residents of Toronto.
Thank you, Francine. Next up, we have John Chidley-Hill from the Canadian Press. Go ahead, John.
Good afternoon. This question's for Mayor Tory. Mr. Mayor, I was curious, are you concerned at all that the city might not be in a position to reopen by the 14th, that you might have to ask for another extension?
I think the time that we've been given will be adequate for us to take whatever additional measures we need to take in terms of on the public health side and making sure people are familiar with all the new guidelines and making sure that we've communicated that effectively. And hopefully we start to see some improvement in the numbers, but that's something you obviously can't predict. But I'm confident that we can take the steps with the resources we will apply as a city and Toronto Public Health to be ready to open safely and to stay open safely. So it's going to be an ongoing thing. It's not any one day, but I'm confident we can do that. That's what we have to do.
And as a follow-up, what's the feedback been like from Toronto's business community, knowing that that it's going to be another week before there might be a reopening?
I think they have the same degree of frustration that I have. I wish we never had to close any businesses to begin with, whether it's in the spring or now. But the fact is that the best public advice we could possibly get, consistent, by the way, with what's going on in every global city in the world without exception, was that we should take these steps. We urged the province to do so, and they did. And so now the task is to open safely by November the 14th, which is in front of us. We will take that challenge on. We were given the extra time, which I think in view of Toronto's size and complexity and the nature of the health problem we face here was appropriate. And we will do a good job of making sure that we are open safely, which, as I've always said, safely is underlined 5 times, and stay open safely, underlined 5 times.
Thank you, John. And last, we have David Ryder from the Toronto Star. Go ahead, David.
Hi there. Just following on John's question. After listening to everything yesterday and everything today, I still don't know whether we are going to go to reopening on the 14th, whether or no matter what. In other words, if case counts go up or there are other concerns, is it possible that we will stay in the situation we are now longer?
Well, I'll start, and maybe Dr. DeVilla will pick up. It's a hypothetical question, of course, but let's remember what is happening on November the 14th is the lifting of a provincial regulation. And we've had the discussion many times before that the city is not in a position to apply a regulation such as that. That's why the province has done it in the interest of consistency and the authority to do so. And so what is now happening is that as of the 14th, that regulation will be lifted, and our job is to do whatever we have to do from the standpoint of public health and communication and other things to make sure that people can open safely at that time and stay open safely, subject obviously to the framework that was laid out yesterday.
And I think the only thing I would add to that is that, as has been the case throughout the pandemic, if the data tell us that we need to do something differently, that we need more measures or we need more time, as I said in my remarks, I will not hesitate, 1, to tell the people of Toronto, or 2, to ask for whatever is necessary in order to keep the people of Toronto as safe as possible. That's my job. I will not stop doing it, regardless of what the circumstances are. We need to look at the data, and I need to provide the best advice and to do the best I can to protect the health of the people of Toronto.
And I ask a lot of questions when I get that advice that Dr. DeVilla will tell you. Lots of questions that I ask, but I think I can say again consistently that I have accepted the advice. Sometimes it gets modified as a result of all the discussion we have or circumstances changing from day to day, but we have one of the very best people probably in all of North America, if not the world, giving us this advice, and we have a whole team of people working with her, and you have those people so you can accept their advice, subject to questions, but accept their advice and implement it in the best interest of the 3 million people that we all serve. She and I and Chief Pegg, we serve the same 3 million people.
Thank you. And the follow-up is for Dr. DeVilla. Just, I'm hoping you can elaborate a little bit on returning to full contact tracing. If you can put it in context of how much it dropped, how much it's going back up, and how much extra resources you need, and who's paying for that? Are you getting help from either provincial or federal governments?
So David, that's a lot of questions all combined into one, and I'll do my best to try to address it as succinctly as possible. We're doing a number of different, undertaking a number of different measures, as you've heard me say. We've certainly brought on more staff. Over the course of the pandemic, we've grown our case and contact management staff from about 50 to start off with to roughly 700. And as I mentioned in the remarks, we're still bringing on another 200 more by the end of this month. So we're certainly trying to grow our resources that way. We've partnered with other agencies, notably our hospital partners we're in active discussions with to see how they might help support this endeavor. And of course, we have a number of different technologies and innovations that we're increasingly using in order to be the most efficient and the most effective, of course, in terms of trying to manage case and contact as part of our response. How soon we'll be able to do this? We're working as hard as we can to get this done as soon as possible. Of course, much rests on what the situation is, what case counts look like on an ongoing basis, and how many of these new endeavors that we're pursuing, some will pan out better, I imagine, than others. And so we're working hard to try to put this all together so we can get back to that situation where we're doing that more fulsome case and contact management as soon as possible.
Thanks, David. That's it for today, everybody. Have a good day.